One of the most common misunderstandings that patients have is that they don't understand that ED is a natural part of aging. Roughly 40% of men at 40 will have erectile dysfunction, 50% at 50, 60% at 60, 70% at 70. It is a natural part of aging. Many of these patients come to me very distressed. What did I do wrong? I have to explain to them that there are things that you can do to help reverse this ED process. One of the best is lifestyle modification, weight loss, diet, sleep, stress reduction. There are things that we can do to reverse the ED process.
You know, the pills that men can take to help kind of erectile dysfunction or difficulty with erections, a lot of times I think men think that they take that in 5 minutes, they're going to have an erection instantly. And so I think that's the most common misconception. Really, those pills need to be taken on an empty stomach, generally a couple hours before sexual activity, and you need sexual stimulation. But many men think that you can take them, pop them, and bam, they'll be ready to go in 5 minutes.
The penile procedures will not change you as a person. You will not be more attractive for the woman having the prosthesis. And you will be the same guy with the same problems and probably with the same psychological things. And the size is the main issue, so you have to explain to patients that the surgery is not the magic. So you can only improve the function, but you can have the size of the penis as it is. You cannot make your penis longer, wider, or you cannot make you as a patient more attractive for the women, so it's impossible, or for partners.
So erectile dysfunction is a very common problem, right? If you're 50 years old, you have a 50% chance of having it, 60-year-old, 60% chance of having it. And just because it's a common problem doesn't mean there's not a lot we can do about it. But it's not a one-size-fits-all solution. I, as a provider, have to get to know you to understand what would be the best treatment option for you. So we have medications like pills like Viagra and Cialis, which have been around for a very long time. We also have things like vacuum pumps or vibration and devices that can help with erectile dysfunction, constriction bands around the penis. We also have intraurethral suppositories or penile injections, which can relax the muscles of the penis to allow for a better, stronger, harder erection. And of course, we have surgical options that are called penile prostheses, which can really help with erectile dysfunction. And so if I don't explain all those options and really get to know you, we have to be able to find out what the best thing is for you.
I think the treatment depends on the etiology of erectile dysfunction. If there is a psychogenic ED, I will refer the patient to a psychotherapy because there is a good chance of the patient being cured. When there is an organic, I discuss with patient 3 options: use of the PD-5 inhibitors, the pills, penile injections, or penile implant.
I think erectile dysfunction usually requires a combination of therapies. Improving overall health status with diet, exercise, weight loss, sleep quality improvement, and psychological stress management is very important and should be counseled to everyone. Combination of sex therapy and pills to improve erections are also very effective and should be the first choice to the majority of patients. These pills are safe and effective. They do not increase your cardiovascular risk and do not cause addiction problems, meaning that once you start taking them, it does not mean that you will only have erections if you do take them. Penile injections of medications that promote erections are often required when pills fail and are also a very part of the effective treatment. Penile implants should be reserved for more severe cases who do not respond to these initial measures.